Do you know the feeling of being sidelined with a running injury? For far too many of us, it's a reality that we face every year. Up to 80% of runners are injured annually. But there's hope, because I'll be teaching you 10 steps to overcome your injury, and I'll be taking these 10 steps and applying it to injured runners just like you to prove to you it works. If this sounds like something you're interested in and you want to keep up to date on more real-life rehab journeys as they're released, make sure you hit subscribe. With the right strategies and a clear plan of action, you can get back on track and reclaim your joy of running once again. And step 1 of 10 is all about finding out why you got injured in the first place. What? Why does that matter? Uncovering why you got injured is important for 3 reasons. 1, it helps identify any weak links in your body, which is helpful for the rehab process. 2, it helps you avoid repeating the same mistake. And 3, you avoid buying into injury myths that lead you away from effective treatment. Okay, let's switch on here, because I'm about to tell you the most likely reason you have your running related injury. And that is doing too much too soon. That's right. It isn't about the shoes that you're wearing or the lack of warm up or your lack of flexibility. Running related injuries are referred to as overuse injuries, meaning for whatever reason, the injured structure has become overloaded and it's past the point of adaptation. Think of it this way. Say every bone, ligament, tendon, and muscle, they all have a certain load capacity. Ideally, in training, we want to hover our training loads close to this capacity. That way, the structure can adapt, and over time, it can withstand greater training loads. But often as runners, we make abrupt changes to our training loads, which far exceed a structure's capacity, and it results in overload. We call this the load versus capacity model. I'll list out some common mistakes and you can see if it resonates with you. A sudden increase in weekly mileage, a quick build-up in speed workouts, introducing hills too quickly, a rapid shift in terrain such as transitioning from a trail to a road too abruptly, and transitioning to a different shoe type too quickly. Keep in mind that all these elements of running are fine, but how you introduce them needs to be gradual and progressive. Let's use a fake case study to illustrate this point. We can then follow this case study through each of the 10 stages. Meet Cody, who isn't Brody, because Brody wouldn't wear his cap backwards like that. Cody just started his running adventure and successfully followed a gradual training plan and eventually reached 5K. His current goal is to run 10Ks, but knows this will take time. One day, he goes onto Strava and sees other runners running a lot quicker and decides to up his game. His next 3 runs throughout the week are significantly faster than previous, and by the end of the week, he starts to notice some serious pain around his kneecap. More on Cody later, because while this training error seems quite obvious, there is a second reason runners get injured which may not be as apparent. And this is having an unhealthy training intensity distribution, which is just a fancy term referring to how hard you're working across the week. As a general rule for most, 80% of your weekly training should be dedicated to really easy running. If this balance is thrown off and you're doing non-easy running, say 50% of the time, you may not have an abrupt change in your training, but the risk of an overload injury is high. But Brody, what if I kept my training loads consistent and still developed an injury? Well, this is when I investigate the third reason runners get injured, and that is excessive load outside of running. This could involve your strength training, your cross training, and even just everyday loading. For example, a few years ago, I developed plantar fasciitis, and it wasn't from running, it was from wearing these new work shoes with a really hard sole underneath, and in the combination, I also increased my standing hours at work. And finally, we have the 4th reason runners get injured, and that is lifestyle factors that hinder the body's capacity. Remember this load versus capacity model I mentioned earlier? Well, your training loads can remain consistent, while certain lifestyle factors can drain capacity, creating a discrepancy and therefore an injury. The main culprits are poor sleep, increased stress, and bad nutrition. Each of these hinder the body's ability to adapt and recover. So be careful with your training if these areas are lacking. But Brody, is it really that simple? What about my running technique or the degree of pronation that I have? This is where it's important to steer away from unhelpful myths, because runners can easily be drawn towards an unhelpful narrative such as overpronation, a leg length discrepancy, having lazy glutes or a weak core, having a shifted pelvis, or incorrect footwear. Say, in Cody's case, it would be a common experience for a health professional to pick out flaws in his running technique and say that he needs to have orthotics because he has one leg longer than the other. This language can be quite alarming and generate a lot of fear. But the truth is, provided your shoes are comfortable, your body will do an amazing job at adapting to even just minor imbalances, provided you have the patience and you train appropriately. In rehab, we call this focusing on the big rocks. The big rocks relate to your training loads and the load versus capacity model. While issues such as strength and flexibility deficits, they're kind of smaller rocks, and then any body malalignment, leg length discrepancy, shifted pelvis, all those sort of things can be just like fine grains of sand. If you focus on the big rocks in your rehab, it will be extremely effective. Even a diagnosis, while it is helpful, sometimes it's not 100% necessary if you follow these principles. Let's go back to the 3 reasons why this step is so important. 1, it helps identify any weak links in your body. So for Cody, he now knows that his knees are the weakest link of his body, and he can do some strengthening exercises to strengthen up that weak link. 2, it helps you avoid repeating the same mistakes. So for Cody, hopefully he's learned now to slow down and not progress so quickly. And the 3rd was to avoid buying into these injury myths that lead you away from effective treatment. So Cody could easily buy into the leg length discrepancy myth and buy some insoles to correct it and wonder why his injury isn't improving. Whether you've found a potential reason for your injury or not, these next 9 steps will help transform the way you think about rehab. These steps are all placed in order in this playlist, and if what I've said made sense so far, keep watching to see how Cody's rehab journey develops.